In the medical healthcare paradigm, there is fraud and waste everywhere. From doctors, nurse practitioners, owners of laboratories that bill Medicaid and Medicare for services, to hospital administrators, pharmacists, etc. And now this Trump's administration's national healthcare fraud takedown movement, the feds are coming for these bad apples in the medical community. The need for greed will not keep you freed from jail and or prison. And so today I have a story for you about two former Mississippi pharmacists sentenced in $786,000 healthcare fraud scheme. Ricky Wayne Quinn, 71 years old, owner of Medical Plaza Pharmacy in Corinth, Mississippi, and John Anthony Andy Knoll, 56, a pharmacist who'd worked there for decades and managed two of its locations. They ran a fraud scheme from January 2017 to December 2021. They put together a list of high reimbursement drugs. So this is how it went down, including diabetic insulin pens, asthma inhalers, and psychotropic medications, and had someone recruit people to get those specific prescriptions from local doctors. So they had people go to their doctor and get these specific prescriptions: diabetic insulin pens, asthma inhalers, and psychotropic medications. So how did the scheme work? Once a prescription was filled, now follow this scheme. It is amazing how we can take all of this creative energy and shift it from positive to negative. And remember, Ricky Wayne Quinn is 71 years old, and the other pharmacist, John Anthony Andy Knoll, is 56. These people are old enough to know better and do better. So once a prescription was filled, the patient would bring the unopened drugs back to the pharmacy, sell them for cash, evidently back to the pharmacist, and the drugs would go right back into inventory. This let Quinn and Knoll bill Medicare and Medicaid over and over for the same single product. The judge noted some drugs were sold, returned, and returned again 4 or 5 times in a row. It also let the pharmacy acquire expensive drugs at a fraction of legitimate costs while still billing full price to the government for Medicare and Medicaid. Billing Medicaid, Medicare, and Medicaid. And remember, I told you in one of my previous stories on healthcare fraud, remember the Medicare budget with the United States government is about $980 billion, bigger than the U.S. defense, the Treasury. It is a huge pot of gold, the Medicare budget for our United States government. So committing fraud from doctors, people that own laboratories, pharmacists, the need for greed is out there for real. So the fraud amount, the pre-sentencing report recommended 30 to 37 months, 3 years of supervised release, and a fine. Total restitution came to $786,972.10. owed jointly by both men to Medicaid and Medicare. So they beat them out of they beat the United States government out of $750,000. So at sentencing, pharmacist John Anthony Knoll, the 56-year-old guy, he pleaded guilty first. This is the 56-year-old pharmacist. He pleaded guilty in September 2025 and reportedly cooperated against 71-year-old pharmacist Ricky Wayne Quinn, who was the proprietor and the owner of these pharmacies. And John Anthony Knoll worked for Ricky Wayne Quinn. John Anthony Knoll received a notably lighter sentence, described in coverage as a single day in prison. Pharmacist Quinn's team tried to get the same treatment, arguing he was a long-time church-going, hard-working family man in poor health with no future risk to the public. Now listen to those adjectives they gave to this 71-year-old pharmacist. Long-time church-going, hard-working family man in poor health. Now, if he was all of those things he was presumed to be on the outside, on the inside, he was just the opposite, because this was not the first time that he had committed this kind of healthcare fraud. This is his second time for this 71-year-old Ricky Wayne Quinn. And it's amazing when these individuals get up in age and get in trouble, say they're over 60, 65 years old, they always say they have major health issues and they cannot afford physically to go to prison. But they weren't thinking about that while they were committing the crime. So, Senior U.S. District Judge Glenn H. Davidson rejected that comparison about him being a loving, church-going, hardworking family man. He noted he read all 244 letters submitted on Pharmacist Quinn's behalf, but said the sheer scale of the fraud required the following guidelines, especially since prosecutors pointed out that Ricky Wayne Quinn, 71 years old, had a prior prescription fraud conviction that got him 5 years probation previously, and evidently that was not enough of a deterrent from him committing this prescription fraud again. So this is the second time this church-going, great, loving person, loving man in poor health, he committed prescription fraud twice. So on June 24th, 2026, Pharmacist Quinn was sentenced to 30 months in federal prison plus 3 years of supervised release, with 3 weeks before he had to report to prison on July 20th. This case was folded into the DOJ's 2026 National Healthcare Fraud Takedown and prosecuted out of the U.S. Attorney's Office for the Northern District of Mississippi, with Mississippi Attorney General Lynn Fitch's office also touting the outcome as part of the state's anti-fraud enforcement push. I'm telling you, folks, between these fake PPP loans during the pandemic, these shell companies getting all that money fraudulently during the pandemic shutdown, you have these fraud cases, healthcare fraud cases that have been going on for decades. The feds are going to be busy and they are coming after each and every one of these folks. So we have to stay alert, stay honest, stay out of the way of the fray. And this is a cautionary tale. The need for greed will not keep you freed. So tell me what you think of this story. Another healthcare fraud takedown. This has been the Trevor Donald Experience. Manifest your truth in a positive, righteous, and God-fearing way.